what we're going to look at, as you alluded to, are the wedge issues and the sleeper issues. And boy, look at the stories of the mess that is called the American healthcare system.
Voters don't want Medicare unprotected. They don't want Medicaid unprotected. And they don't want, I think it's 77%, don't want the Affordable Care Act, Obamacare, unprotected.
So I see that as something that has potential to perhaps go to the level of what immigration was.
It's Friday, and that means it's a regular edition of our podcast, Real Polling in Real Time with Zogby. And we have some fresh data about the issues that we face today, and perhaps a surprise or two. How are you doing, Jared?
I'm doing great. How about you?
I'm doing well. And I want to kick us off as to what we're doing. You know, there is a tendency to do polling on, well, what are the top issues? What are the top two issues? And then for the media and the debate to focus on the top two issues and give it all the attention, give them all the video. So today, when we ask voters, well, you know, it's patently clear. Immigration is either one or two, and the economy, inflation, is number one or number two. And obviously there's a lot of attention because there's a lot of anxiety over both. But I am reminded of the campaign and election of 2008, where, as you know, towards the very end of campaign, September, John McCain, the Republican, Barack Obama, the Democrat, the focus of attention obviously was the economy, because the rug was pulled out from under the economy, and we went into recession shortly after the stock market crashed. And yet our polling at that time for Reuters and C-SPAN clearly showed that when we asked folks, what's the number one economy issue for you? Number one was healthcare. The affordability, lack of affordability of healthcare, and the fact that there were too many Americans who are not covered by health insurance. Interestingly, no one really drilled down. Reuters did, because it was in their poll. So that brings us to today. Immigration and the economy, with good reason. But there was one issue that was in a very solid third place that warrants our attention today. And that issue was healthcare and affordability and quality of healthcare. And I'm not sure it's getting the national attention that it deserves. Why don't you pick it up from there? Because you have some numbers to relate, and we'll follow with a discussion.
Yeah, I mean, first I'll say that we always keep it, you know, some pollsters have a list of 15, 16, 20. And I think that's great. I've kind of always liked to keep it at 10 to 12, because it just seems that's about, I mean, really, probably most voters are driven by 1, 2, 3, or 4, maybe 5 at most. But we do the other 5 or 6 to see what can bubble to the surface. And so what we're going to look at, as you alluded to, are the wedge issues and the sleeper issues. And zeroing in, I mean, as you noticed or mentioned, inflation is number one. Almost half of voters cited that as the issue that drives them to vote, who they decide to vote for. And immigration and the southern border came in at almost exactly half the amount, 23%. And, you know, when we were polling throughout 2023 and 2024, typically only 2, maybe 3 issues ever went above the 20 mark. And it's 2 of them are the ones that I just cited. And as you mentioned, now, for the first time in a long time, we're seeing health. But, you know, I did a little twist on it, because a couple months ago, I tried health and diseases. And then this month I tried, and when I did health and diseases, that was only about 10 or 11%, which is still significant. But this time I did Americans' health and healthcare, and that's 21%. And then from there's a pretty significant drop off where the number 4 issue is trade and tariffs, which goes to 16%. And then down to Bill of Rights and freedom of speech, 13%. And crime and public safety, which throughout 2024 was the number 3 issue, is now at 11%. I suspect the voters who were driven by it now feel safer with Trump in office because the perception is he's taking care of that. We'll see in 6 months to a year, but it's important to note the messaging that we're looking at Americans' health and healthcare. And what that tells me is now that is now full-fledged in the top 3, that voters are concerned not only about the deterioration of their health, but the deterioration of the healthcare system. And boy, look at the stories of the mess that is called the American healthcare system. So I see that as something that has potential to perhaps go to the level of what immigration was, because that is kind of like a basic sense of standard of living, safety, if you will.
There's so much going on here with that issue. And let's be fair and honest up front. And I know that you'll totally agree. Every day, people are healed in this country. Every day, there are miracles that happen because of quality health care. And there are people who go home with satisfaction that they have been treated well. By the same token, it is a major cause of anxiety. On a number of levels. There's systemic issues. That means a lot of bureaucracy, a lot of building, the cost of science, and things that need to be addressed because we're talking about a lot of waste. Number 2, there is the lack of access to good health care. I remember years ago, there was a multi-part series in USA Today, and one of the series focused on Harris County. That's Houston. Houston has a city within itself devoted to healthcare, 150,000 employees. And yet, about a third of the residents of Harris County had zero access to that healthcare excellence in Houston. Back then, it was a lack of access to health insurance. Number 3 is the personal side, and that is that more and more Americans have insurance than ever before, but the insurance doesn't always cover enough to satisfy patients, nor enough to satisfy professionals. And so both sides end up dissatisfied, and hospitals are on the verge of bankruptcy, in too much debt because they can't afford the current system, can't afford to reform the current system, and it's very messy. So, it's fascinating because, as you know, the Affordable Care Act back in 2010 passed only on a partisan vote and barely, and yet today we find it in our polling and see it in the polling of others. In fact, we had a question in this poll. Voters don't want Medicare unprotected. They don't want Medicaid unprotected. And they don't want, I think it's 77%, don't want the Affordable Care Act, Obamacare, unprotected. They see the need for people to have coverage. And yet, there are still a lot of people falling through the cracks.
Yeah. And what you say that speaks to me is the fact that this issue that we're dissecting and analyzing is so all encompassing. that it pulls in so many different dimensions of what voters have to go through in their day-to-day lives on the finance and debt side, on the actual health side, on the side of the bureaucracy, and even beyond. And that's why I think, I mean, I feel comfortable saying, it sounds like you would agree, watch this issue, because there's an even other dynamic to it. And, I did a lot of polling on this and have explored that, now there's the MAHA movement, which started out kind of the nucleus of which was the, I guess you would call it the medical freedom, and the folks who were opposed to the mandates, the COVID mandates. And then as Trump won, that was rebranded to MAHA, and that brought in a lot of conservatives and independents onto that train, and expanded to healthy food, what's in the soil, what's in the water, what's in the air, and chronic diseases. And so if you look at the fact that this MAHA is actually now effectively a wing of the Republican Party and has become mainstream, that's going to be another driving force to health as a major issue. But as you point out, from the liberal and the Democratic perspective, it's going to be ensuring greater coverage. And so this is going to be a fascinating dynamic on both sides of the political spectrum and across the aisle.
And I don't see any reason why there cannot be consensus around this. We've asked for many years about healthy eating, about exercising, about preventative health care, about staying healthy and living a good lifestyle. And there is no partisanship there. You would expect, years ago, I would expect the typical health care not to be from Vermont, to live near Burlington. When the reality is, no, it's in Nebraska and in every red state as well. This is a concern. Obviously, there are going to be difficulties in approaches, but this, as we're discussing here, this has to be addressed. Mm-hmm. Just like Barack Obama addressed it. And now, 15 years later, his efforts are viewed as heroic, and the Affordable Care Act is embedded as much into our psyche as Medicare, Medicaid, Social Security, and so on. But we have to be focusing on our institutions and on our insurance as well. Have to.
Yeah, and to your point, when we drill down to political party, 27% of Democrats, which is actually citing Americans' health and healthcare as the number 2 issue. It's number 2. Inflation, of course, is number 1, 41%. But watch when we go to Republicans. 16% rate Americans' health and healthcare. Just as many, 16% rate crime and public safety. And so those two are actually tied for the top 3 among Republican voters. And for independents, it's actually by a slight amount, 22% of them, it's their number 2 issue. And so there is great room for convergence. Of course, we always have to just be concerned and aware of the forces of division that, is the nature of politics. And hopefully there are some coalitions that can move beyond that.
Yeah, hopefully. There was news just this week that Aetna, one of the largest health insurers in the country and a major player in insuring the previously uninsured under the Affordable Care Act, has pulled out of, or announced at least that it's pulling out of the Affordable Care Act. That's a horrible dent. That means that federal government is going to have to go scrambling to find another insurance company or companies to provide health insurance. federally subsidized insurance for the uninsured. Yeah, this is messy, and we're not even scratching the surface on the degree of this issue. But I'm glad that that we're talking about it, and I'm hoping that this nation can have a discussion. Town meetings, in fact, leadership from the administration on the next steps to ensure both quality and coverage for tens of millions of Americans. And to those of you listening and watching, understand that we do a monthly poll and welcome groups, organizations, even individuals to join in and to purchase questions at a very competitive low price. So if you want to join our omnibus survey, you can go to our website. Okay. Have a good week.
Have a good one.